The 3-step skincare routine for acne, a revolutionary approach. What is the best skincare routine for acne? How do you choose the ideal regimen to prevent acne breakouts? Join me in this masterclass as we dive deep into the science of acne and the art of skincare routines. This episode is brought to you by Eucerin's Pro Acne Solution, a dermatologist-recommended holistic approach addressing the underlying causes of acne from the outside in. Beginning with the science of acne. Blackheads, whiteheads, and acne bumps are commonly attributed to pimples, known medically as the condition acne vulgaris. There are a few subtypes to be aware of, namely acne vulgaris, physiologic acne, adult acne, hormonal acne, drug-induced or steroid acne, occlusion acne, for instance, maskne. That's a long list, but let's go through each of these so you have a better idea of what they are about. While all types of acne are classified under the umbrella term acne vulgaris, dermatologists tend to distinguish between different severities of acne this way. In those with mild acne, they tend to have less than 3 to 5 pimples per month. If this occurs in teens, it's known as physiologic acne. Those suffering from moderate acne will have up to 20 lesions a month. Anything more than 20 lesions and/or the presence of cysts would make the condition on the severe end of the spectrum, and this would usually require treatment with oral medications. Now, to be clear, acne vulgaris is a term that encompasses various forms of acne: whiteheads, blackheads, papules, pustules, and cysts. Whiteheads and blackheads are known as open and closed comedones, respectively. At this juncture, it's helpful for us to elucidate the exact process that explains how acne bumps come about. At about 2 to 4 weeks prior to an acne bump appearing, the process begins in the deeper layers of skin. Microcomedones are mini comedones which are formed at this time. These invisible bumps, driven by genetics that influence inflammatory processes, make their way towards the surface of skin. When it rears its head, that's when it's officially regarded as a comedone. A closed one, also referred to as a blind pimple, is readily recognized as it is without a head. This contrasts with open comedones, which appear to the naked eye as little pores within which are black dots of dirt. Now, here's a fun fact: blackheads don't actually contain dirt. Rather, it is the oxidation of sebum that leads to this blackish tip appearance that accounts for its common name, blackhead. From the time a comedone becomes visible on the skin surface, it also becomes vulnerable to infection. Most commonly, surface bacteria lead to the formation of an inflamed acne bump known as a papule, one that is red and painful as comedones get infected with bacteria. A certain type of bacteria known as gram-negative bacteria is also fairly opportunistic. It is at this juncture that comedones and/or papules can get secondarily infected, leading to a type of skin condition known as gram-negative folliculitis. And this is the original what dermatologists term as a pustule, a type of pimple characterized by pus at its tip. Cysts go even deeper. Typically arising from one of the above types of lesions, infection and inflammation cause a deeper lesion to form. Cysts tend to be persistent, lasting several days or even weeks, and can be complicated by abscess formation when pus especially collects within a cyst cavity. Cysts are also likely to lead to deeper acne scars. The following relate to descriptive terms attached to acne vulgaris and are important for understanding how acne affects certain age groups differently. Physiologic acne is linked to the onset of puberty and is considered a natural process, one of the body adjusting to the release of sex hormones at puberty. It tends to be mild and self-resolving. Adult acne, on the other hand, is a very broad term and is sometimes used interchangeably with hormonal acne, one which dermatologists have argued is quite redundant, for all acne must be regarded as hormonal in nature. On this note, it is helpful to point out that a specific type of hormonal acne is directly linked to hormonal dysregulation in adult females. Polycystic ovarian disease, also known as PCOS for short, can present with adult-onset acne, excess facial hair growth, and irregular periods in females. Treatment is typically in the form of oral contraceptive pills, and co-management with a gynecologist is usually recommended. The other types of acne can perhaps be considered rarer subtypes. The use of oral and topical steroids can lead to a form of acne known as steroid acne. Occlusion of skin via face mask wear or headgear can also lead to occlusion acne. Moderate and severe types of acne require treatment with prescription oral medications, which is beyond the scope of discussion here. However, all types of acne must be addressed with at least a consistent skincare routine that targets various factors such as excess sebum production, inflammation, infection, oxidative stress that worsens inflammation, acne marks known as post-inflammatory hyperpigmentation, and acne scars, which present in the form of deeper dermal scars. With this in mind, we will now turn our attention to a minimalist 3-step skincare routine that can address all of the above contributing causes in order to holistically treat acne, acne marks, and scars while preventing flare-ups. Step 1. Cleansing. The ideal cleanser for acne-prone skin is one recommended for sensitive skin types as well. Many times, prescription acne treatment causes skin dryness and sensitivity, and this is the reason why dermatologists often recommend gentle cleansers to accompany acne treatment. However, such a cleanser must also fulfill the function of stabilizing the skin microbiome. A dysregulated microbiome is in fact one of the underlying causes of acne. Cutibacterium acnes has been identified as the causative bacteria in acne, but it is also one that naturally exists on the surface of healthy skin. So the real question is, why do some individuals get acne and others don't? Acne isn't caused by dirty skin, but it can be worsened by poor hygiene. This is where cleansers that respect the skin moisture balance, at the same time removing excess oil, dirt, and grime, are regarded as ideal for acne-prone skin types. The Eucerin Pro Acne Solution Cleansing Gel is a soap-free and fragrance-free gentle acne cleanser that removes excess sebum with a gentle exfoliating action that regulates cell turnover, hence reducing pore clogging. Step 2 is the serum. Eucerin's Pro Acne Solution Triple Effect Serum with patented thiamidol and salicylic acid treats acne marks at its root, which is the production of melanin. Eucerin's Pro Acne Solution Triple Effect Serum contains patented thiamidol, which effectively reduces acne marks and scars at its root. Post-inflammatory hyperpigmentation occurs quickly after an acne bump resolves, a result of excess melanin production. Thiamidol targets this by removing excess pigmentation, hence addressing the problem at its root. Salicylic acid, on the other hand, is a beta-hydroxy acid. BHAs unclog pores and also gently exfoliates, hence supporting the skin cell renewal process. Salicylic acid in particular is known to reduce and prevent acne marks as well as future breakouts. Serums are the ideal vehicle to deliver high doses of concentrates, which is not as efficiently formulated in a cream or lotion vehicle, for instance. Serums that contain ingredient pairings such as thiamidol plus salicylic acid are particularly effective when tested on acne patients. Such a product resulted in reduction of acne, acne marks, and an overall brighter skin tone in as little as 2 weeks of use. The thiamidol and salicylic acid ingredient pairing makes for an excellent holistic approach to acne-prone skin, with more than 95% of study participants reporting anti-acne skin brightening effects and also anti-shine skin mattifying benefits. The serum is to be applied on the whole face. In step 3, you treat with Eucerin's Pro Acne Solution AI Clearing Treatment, which contains 10% hydroxy complex and glycocalcone A. An effective acne skincare regimen is one that also prevents flare-ups. One of the greatest frustrations of acne sufferers is the recalcitrant nature of the condition. Before skin has a chance to clear up, a new pimple emerges. This brings us back to what we have discussed earlier. Before whiteheads and blackheads even show up on skin, they have actually been brewing in the deeper layers for at least 2 to 4 weeks prior. What this means is that we can institute a regimen that actively targets these invisible microcomedones. When used regularly, this will reduce the number of whiteheads and blackheads. The Pro Acne Solution AI Clearing Treatment is also designed for full-face application, featuring 10% hydroxy complex, a highly effective combination of salicylic acid, glycolic acid, and polyhydroxy acid. The last step of this regimen can visibly reduce acne and prevent reappearance. This proprietary mixture has been shown to be highly effective, with 81% of participants describing a significant anti-blemish effect, particularly so for inflamed acne bumps, with 86% reporting effectiveness in prevention of flare-ups and appearance of new blemishes, and 84% attributing a skin-soothing effect to the use of the product. Glycocalcone A in particular is incorporated as an anti-inflammatory ingredient that helps to soothe irritation in as little as 7 days.